For months, US President Donald Trump said COVID-19 would magically go away. But nearly 4 million infections and more than 140,000 fatalities later, the optimism has faded.
It will probably, unfortunately, get worse before it gets better. Something I don't like saying about things, but that's the way it is.
His about face comes as polls show 6 in 10 Americans are unhappy with the way Trump's handled the pandemic. And the largest COVID-19 outbreak in the world has crippled its largest economy. The Atlanta Federal Reserve says second quarter GDP likely shrunk by more than a third as states went into lockdown. Despite improvements in the job market, more than 17 million Americans remain out of work. Before the pandemic, the number was well below 1 million. And almost 7 million Americans could be kicked out of their homes by the end of July, when enhanced unemployment benefits expire and eviction bans end. The pandemic is also further eroding relations between the US and its top trading partner, China. The State Department has ordered the closure of Beijing's consulate in Houston, Texas. It follows allegations Chinese hackers attempted to steal vaccine data from American researchers.
There's been this long challenge of the Chinese Communist Party stealing intellectual property. We actually talked about this. It's not just American intellectual property but stolen. It's been European intellectual property too, costing hundreds of thousands of jobs.
China called the allegation slander and threatened to retaliate.
We urge the US to immediately reverse its decision, otherwise China will take legitimate, necessary actions.
That's as the race for a vaccine heats up around the world. The US has committed to spending $2 billion for 100 million doses of a drug being developed by Pfizer and Germany's BioNTech. Another $2 billion in subsidies have gone to other firms developing vaccines. The Trump administration plans to distribute those vaccines for free and will have to get the economy moving again without any magic involved. Paolo Montecillo, TRT World.
Well, for more on this, let's hear from Doctor Andrea Feigl in Washington, D.C. She's the founder and CEO of the Health Finance Institute and was a former health economist at the Organization for Economic Cooperation and Development. Welcome back to the program, Doctor. Now, as we heard there, US President Donald Trump has given his first public briefing on the health crisis in months, and he seemed to strike a more somber tone during this briefing. He's now called masks patriotic. He says things will get worse before they get better. What did you make of what he had to say? Was it what you wanted to hear?
Thanks so much for having me again. I would say to that, better late than never, to encourage the American public to wear masks and to show some leadership, because it's a real tragedy in terms of the number of deaths and cases that we have each day. So in that sense, I welcome very much the statement and the emergence of leadership that seems to be happening. That being said, we will likely see more than 2,000-3,000 cases per day, deaths per day in the coming weeks, and we are not over this yet.
No, we certainly are not. And as we know, the US is still the world's coronavirus hotspot with almost 4 million cases and more than 142,000 deaths. Can you explain to us, how did it get to this point? The fact that in some cases in the country, it's actually worse than it was several months ago.
Yeah, I mean, there are manifold reasons why we're in this really dire state right now. We actually have 4,050,000 cases. I think I just checked the numbers. At the beginning, there was a real denial of the crisis and that it's affecting in America. I'm talking January, February. There was a massive delay in testing throughout March. And then there was a delay in really taking national responsibility to a national crisis. So instead of giving the ownership of the crisis, keeping it at a federal level by putting governors in charge and having piecemeal approaches, we could not wrap our hands around this pandemic. So these are the three issues that I really see have led us to this dire state.
And what about the issue of masks? We know people like Donald Trump have been in denial about just how effective they are in preventing the spread of the virus. Now, he seems to be changing his tune, but why is it that many Americans really see it as an affront to be forced to wear masks?
I think it has a lot to do with individual culture. And obviously, not obviously, but to Americans, obviously, public health is something where we have to basically come together as a society and show solidarity. My masks prevents your infection and your masks prevents mine. American culture is a culture of individuality. So people want the freedom to choose at pretty much any cost, as we see at the cost of hundreds of thousands of lives. But we're starting to come to a reckoning because it's hurting school openings, it's hurting families, it's hurting the economy. So it's not feasible to remain in denial if you want, if you don't want 300,000 deaths at the end of the year.
We certainly don't. Now, we know states like Florida and Texas seem to be regularly recording record numbers of cases in their states. Is there a direct link between states that have really rushed to reopen their economies and the surge in the number of cases we're seeing in those places?
There's an absolute direct correlation. So you look at Arizona, you look at Texas, you look at Arizona. They have had a very weak closing comparatively. They haven't had mask mandates that were strong enough. And on top of that, they reopened too early, allowing the virus to come to a resurgence. And even other states, like, for example, Maryland right now has an increase again, versus New York. They were hit very hard, but they were able to, with very draconian measures, some would argue, get that crisis under control.
Now, what would you say would be the effective steps that leaders need to take in order to really get a handle on this crisis so it's no longer out of control?
I think it really matters to have a mandate at the national level. It's not enough to leave these decisions to governors alone. I think there needs to be a coming together nationally around the wearing of masks, around the probably restriction of some economic activity and movement of people, so we can really, over the next 2 months, get this better under control. And then hopefully in the fall, especially when schools are open, allowing kids to not have their education stunted. Kids need to be in school. It's a mental health issue, it's an education issue. And we also really, really need to start caring more about the survival of our fellow human beings.
Okay, Dr. Andrea Feigl, founder and CEO of the Health Finance Institute, thank you again for joining us on the program.